Hello, everyone, and welcome to another episode of Beyond the Superficial. We are chiropractors and functional medicine practitioners at Synapse Center for Health and Healing, located in Eagan, Minnesota. Information shared in this podcast is not intended to diagnose or treat any medical conditions. Please consult with a primary care provider before engaging in any new activity or protocol. With that in mind, let's dive into this episode.
So welcome. This is our podcast, which is Beyond the Superficial. We've been in our menopause series for the last few weeks, and we'll be talking today about bone health and strength. So why weight-bearing exercises matter during this time. So there'll be a few topics that we'll touch in regards to this, and we'll get a deeper dive into that. But as far as introducing who we are, I'm Jenica. I'm a health coach here at Synapse.
Dr. Ashley, functional medicine chiropractor here.
And I'm Dr. Ellie. I am our pelvic floor therapist and I specialize in hormones.
So getting us started, estrogen. We've been talking a lot about that through the menopause podcast and each week. There's been kind of a correlation with that, and seeing that as far as bone health goes and strength, what is that connection between estrogen and bone density? Putting people maybe at risk for for osteopenia or osteoporosis.
This is probably kind of I'm sure there's a lot more that goes into it, but as we get older, as we all know and been talking about, estrogen has a tendency to go down, and estrogen makes osteoblasts. So osteoblasts are those cells that grow our bone. So that's a huge correlation with the hormone piece and the bone density piece too.
Yeah, so estrogen has that direct impact on the bone. And then it also has a direct impact on muscle too. So estrogen helps keep the muscles big, and it also keeps them moist and healthy. And so if you don't have healthy muscles, you don't have healthy bones. So estrogen impacts it in those two main ways. One, the bone directly, and then also the muscles. And we'll kind of deep dive into the muscles a little bit more too.
Yeah, and testosterone too. That's why even like with bioidentical therapy to that, Rochelle does her PA. Because testosterone will get aromatized or mated to estrogen too. So if there's a decrease in both testosterone and estrogen, that's where we can intervene and making sure that we're keeping adrenals healthy, keeping DHEA levels up, and then just making those conversions too. So there's a lot that goes into it in terms of hormones and precursors and all the things that we can do to help support it naturally as well.
Yeah, so what I'm kind of hearing is it's going to happen. You're going to lose probably some muscle and some bone density naturally going through this phase. But there might be things we could do or help things to prevent it if you can kind of get on top of it.
Mm-hmm.
Right?
Yeah, and there's a really good graph out there that we just learned this last weekend that we saw. So like usually that bone density starts to take a dip around, I want to say 52. So if we can... So the curve kind of looks like this, right? Mm-hmm. And if we can intervene at, 45, 50 and prevent that curve and keep it straight as long as we can, because we might see a little bit of this, but if we can prevent that decline and intervene as early as possible, that'll be incredibly important. And then catching it too, like when our girls are in their teens, because we grow the most bone in our teen years, so making sure our girls are eating enough. We're not overtraining and not underfueling ourselves. It's huge to intervene literally as early as possible, especially in those teen years.
Yeah, because it can happen before then. That's my understanding too, with making sure you're getting enough food in, not overtraining, and then also making sure you're having healthy menstrual cycles too, because when we go periods of time without getting cycles, and Dr. Ellie could probably speak on this too, no matter what point in your life could lead you up to like a risk factor at the menopause period. And then genetics also, I've heard, playing a role in that too. So like if you have a family history of osteopenia or osteoporosis or anything kind of around that side of things, that could make you want to start thinking about it in that upper 40s range for sure.
Yeah, I'm going to talk a little bit off topic, just slightly, of why we care about our bone health. Yeah, because often people are like, it's our bone, why do I care about it? And One, because bone is metabolically active, and so you want to be able to have strong bone, because if we are depleted in any sort of nutrients, sometimes we need to pull from our bone. So it's kind of like a safety mechanism. But then two, most importantly, is that we need strong bones so that we don't break them. One of the number one causes that the older Americans are in the hospital is because of a broken hip. And now most people don't necessarily die directly of a broken hip, but then they go to the hospital and then they get these crazy hospital-derived diseases, like really antibiotic resistance or staph or different types of diseases that I'm forgetting off the top of my head. And then those kill them. And so what we're seeing is that people, especially women who have strong bones, especially hips, if they fall, they don't have to go to the hospital and they don't have those long-term consequences. So it really is a huge factor on, one, prolonging your life, but then also just quality of life too.
Absolutely. It's been a hot topic recently, and it's been coming out with people like, why do I need to know about this? And maybe you both can speak to this a little bit more too, of why has it become more of a thing? Why do we have more information on it now than maybe we did in the past, or more awareness to use these preventative measures? Are we seeing an increase in diagnosis? I mean, even just here or everywhere?
Mm-hmm. I think the research is becoming like more and more robust too, that it's not just calcium. Should I go into this now?
Sure. Yeah. No, I think this is a great time.
So it's not just calcium. We're finding a lot of it does stem from the gut. I feel like we hear about that a lot, but it's true. Like we're just finding more and more about it as we age too, especially like around menopause, postmenopause. Our stomach acid decreases the secretions of the stomach acid, and that just happens naturally as we age. But then also like stress is a huge one that decreases our ability to make stomach acid. So we need a proper pH of our stomach acid. So when people are having like acid reflux, let's say, that lower esophageal sphincter is actually triggered shut by enough stomach acid. But what will happen is you'll go get prescribed a PPI, proton pump inhibitor, or an antacid, and that sphincter is still open. You're just not feeling it anymore. But that PPI will decrease our ability to absorb and break down calcium and protein. So then it really just like sets off this osteoporosis kind of cascade, if you will, because we literally don't have enough stomach acid to digest anything. Because you can even see them in X-rays too, like. An older woman will go get an X-ray because they did break something, and they'll find their Tums, that's made out of calcium, and you can see it in the X-ray. Like they're literally just not able to digest calcium anymore. So that's one huge thing that we start off on when someone comes to me for osteoporosis, is we need to get that pH balance of the stomach.
So kind of no matter how many supplements they take, it doesn't matter because your body won't absorb it.
Mm-hmm.
So it's so much more than just taking a calcium supplement.
Or upping your calcium in general. Yeah. And so kind of taking that back, because I know we did do a podcast on osteoporosis. So if you have a chance to look back at that podcast, because it does really give great information just in general about bone health for both sides, for men and women, which has also been a great topic. So when looking at for menopause, that menopause correlation of when we see that estrogen change, that gives us, it becomes a risk factor, right? Just because of what changes during this time period. So I know you mentioned testing, possibly like when we want to start looking at that. My understanding is like a good time is that perimenopause time period to check your bone mass, or your bone density and muscle mass at that time. And we talk about the DEXA scan a little bit in the osteoporosis, and I think there's been a lot more improvement on that test and a lot earlier detection because of it, which could be why we're seeing this a little bit more frequently too. But okay, so when should a woman, like who is about to hit that perimenopause, or maybe in this range of like, I'm in my upper 40s, am I a person that should get it checked? If so, how would I know if I'm that person, and what would I do kind of next? What are you looking for?
Yeah, I mean, you can kind of go based off of like risk factors too. So like if you have a family history of it, you might want to check it a little bit sooner. But yeah, it doesn't hurt to get a DEXA scan anyway. With DEXA scans, they can be off a couple of percentages. So something to keep in mind is you want to have the same machine. So like go to the same place. So same machine, and even the same person who runs the machine if possible, just to keep those factors as steady as possible. When it comes to testing too, if you just kind of want to see what's going on, there's more than two markers, but two big bone specific markers that I look into is a bone reabsorption marker called CTX. It's a collagen propeptide marker that'll make sure that our bone reabsorption is not happening, so like bone breakdown is not happening at too fast of a rate. So I want to look at that marker. And then also another marker, it's a pro-collagen peptide, so it's more like a bone building marker. So that's just a really great baseline to get, because then if we do run into some bone density markers or issues down the line, we can look at that baseline. And even our BIA, bioelectrical impedance analysis, it'll show us a baseline too of skeletal mass and skeletal muscle mass too. So it doesn't hurt to just get those baselines checked as soon as possible, around 40, 45. I would say it'd be a good time to check. And then just looking at inflammatory levels too, because that we're finding inflammatory levels play a huge role into bone density too. So just giving solid blood panels.
And a really good benefit of getting tested before is, one, later on in life you have a comparison, which is always nice, because you always want to compare it with yourself, because women are just so different. But then two, also prevention and early detection is key. Once you do lose bone mass, we can build it back, but to a certain point. And so we are limited. And so if you notice, oh, hey, I'm losing bone and I shouldn't be, I'm only 40, let's get on that right away so that you prevent it so much quicker and earlier.
Yeah, great. And so maybe we get the scan, maybe we don't, but we're at this phase, or wherever you are in this journey, perimenopause, menopause, postmenopause, or even just preparing for that phase. What can we do to help prevent losing muscle mass and bone density?
So one of the best things is building muscle. So there's this law called the Wolff's Law. And what it says is that a structure under stress will morph and change to the stress that is applied. So this relates to bone in the way that the muscle attaches directly to the bone. When the muscle is contracted, it pulls on the bone in a healthy way. And that actually stimulates those osteoblasts that Dr. Ashley was talking about to build up more bone. And so you kind of want to think about as your bone almost, and it's kind of easier to think about it as a square, and you want to contract the muscles on all sides of the square to make sure that your bone is healthy on each side. And so what we find is that a lot of women are actually pretty healthy in the front and the back of their bone, but on the sides, especially in the hips, that's where we notice the weakness, because we don't do a lot of side to side or lateral motion in our day-to-day life. And so as women, well, everyone could probably benefit, but especially women, we need to be intentional of doing side-to-side motions, activating that glute medius, especially to really build that outer portion and inner portion of our bone health. And that is one of the best prevention of hip breakage.
That's really great. Yeah. And then from like diet perspective too, just making sure we're eating a nutrient dense meal, because zinc, they're finding more and more now that magnesium is so incredibly important with bone density too. So just eating plenty of protein, even throwing in like a digestive enzyme every now and then with a little like hydrochloric acid, HCl in there, or some like bitter herbs like dandelion tea, just to help stimulate your own stomach acid production too. Just some diet stuff too you can do.
Yeah, eating whole foods, right? And that, I think we've seen like that push for calcium, because during that time, push for calcium, which pushed for milk, we didn't see a total decrease in osteoporosis, from my understanding, but that it really was a change of how we were eating. So we, at that time period, a lot of, processed food and quick, easy meals, because the home dynamic changed, or accessibility changed, or things like that. So eating, whole foods is rich in calcium, is rich in zinc and magnesium, and vitamin D, another important.
Vitamin K,
and
boron.
vitamin K. Yeah, all great pieces to that. Kind of back to the weight training that you mentioned. What are some ways, what if somebody doesn't like to lift weights, or, CrossFit is kind of where I go to in my head of like heavy lifting, powerlifting, strong, muscle building. lifting or exercise. What if somebody's not quite there? What can they do now to still build that, put that pressure and build that muscle?
On more of like a basic, like beginner level, fast walking, so not like a little stroll in the park, but like fast walking can actually have some of that healthy impact. Even like adding on like a weight vest too, even if it's, you know, starting at 5 to 10 pounds, just starting super light, progressing to maybe like a 14-pound one eventually, but just doing like a 30 minutes of fast walking, throw on a weight vest if you're up for it. Just as simple as that can stimulate some of that bone growth too. Or something I like to use in the clinic here too is a vibration plate. So if you get a vibration plate, we're looking anywhere from like 30 to 50 hertz of that vibration to stimulate that bone marrow to produce and turn on those osteoblasts, get that building cells going.
The nice thing about the Wolff's Law is that a little bit of stress is also beneficial. And so if you just move in any way, that will help your bones. Of course, the more that you stress it out, the more growth that you get. But if you're not there, anything little will be beneficial. So, you know, even if you are really into Pilates, that is also really good for yoga. Anything that just pulls the muscle on the bone will help the bone. So don't feel like you have to go lift 100 pounds right away. You know, definitely do what you love and your body will react to it.
Yeah. With that, kind of building off of that too, you know, there are benefits to all those areas of building muscle, but that weights are a big tool for that, and seeing kind of the results where we need to see for reversal or prevention. Movement's key, and so starting to that point. But I do know that, you know, 3 to 4 times a week, you mean give or take what's doable for people. Find a program that works for you that includes some type of weight. So whether it is Pilates that works for you, how can you incorporate some kind of weight training within that a few times a week? Or walking with a weighted vest. So you're doing these things, but even like there's sculpted yoga classes now that incorporate weights a few times a week. Do what your body can, but having, just as you talked about that scientific side, having that weight bearing exercise is important, and it helps regulate a bunch of different areas as well by putting that pressure on your body and that little bit of stress, I should say.
Yeah, weight training is definitely the best way to prevent it. If you have a high risk, that's hard to go around that.
Absolutely. So my mom is like postmenopausal right now, and I've been pressing multiple times, like to pick up her weights, because she'll walk. And I'm very curious. I do need to really encourage her to go get a DEXA scan, but she's definitely at the point that she could, because I think that she would be surprised if her bone density came back low because of how much movement she does. But there's benefit to that, right? She's seeing so many other benefits to moving her body, but not incorporating that weighted exercise. Like, this is something that's directly correlated with that piece, is my understanding. So that's something I need to do, is push her forward and just be curious, and then also the genetics and things for myself. To kind of know how much, but social support being a part of this. So the other piece of like, where do I start? But also, why should we incorporate for our lifestyle change that to be something like a CrossFit class or a Pilates class or weighted vests with friends and family? Do you feel like that is an important piece to that, of like how we do it at the same time?
I feel like it keeps you consistent. Consistency is a huge key, and if you have like a tribe around you, or like that social where you're gonna like see that person, like, you know, you have like people watching out for you, and like the accountability piece too, I think becomes huge with importance.
Yeah, it just makes it more fun. When things are fun, you do them. And so
good for the brain.
It really is. It builds confidence and it pushes you. We talked a little bit about this last podcast, but when you're with groups, you like work harder and you push yourself more, and you do wake up early because people are expecting you.
Yeah, and important when we're kind of you're not going through this alone, right? To there can be a lot of ups and downs going through these periods of menopause, perimenopause, and postmenopause. That you're learning new things. Your body is changing, and it constantly is changing. So, being able to have relationships and do things that you enjoy is going to be key. What's going to get you up and moving. So, yeah, wonderful. Anything else you wanted to add?
I guess should I go over like some supplements I do like to use?
Oh yeah, supplements are great.
One of my favorites recently has been OsteoStim from Osteo Naturals. The doctor who developed that supplement, he wrote the book Great Bones, which has some really great information. So I recommend reading that book. But that doctor was actually diagnosed with osteoporosis like in his 30s, and he had some like severe gut stuff going on. So intestinal permeability, he had infections. So some of that testing can also be helpful. But in that supplement, the Osteo Naturals, one I'll use as conjunctive therapy, it'll actually have goat milk whey based protein in there. So did a lot of great research on goat milk whey. So that is a good one to add in. And I'll actually have berberine in there. Berberine helps with insulin resistance because there's a correlation with insulin resistance and bone density issues too. There's milk thistle in there. I'm trying to think what else. Boron. Boron is biotin, also a huge one. But there's just a lot of great ingredients in that supplement. I do like to use quite a bit. I'm on making sure taking out seed oils and all those inflammatory pieces too, because that'll just stimulate like osteoclast to kick in, which is the bone breakdown. So just making sure, probably more of an anti-inflammatory type way of eating.
Yeah. What would be kind of your first tip to anybody in this period, this menopause time, to do for their bone health?
Get out there and exercise.
Yeah, I feel like there's no way to go around exercising weights.
Grabbing weights.
Yeah.
Grabbing weights a couple times a week.
Yeah, grabbing weights and cleaning up the diet.
Yeah, I don't think you can have strong bones if you don't do weights.
There you go. Go grab some weights. Thanks for joining us on this week's episode of Beyond the Superficial. Again, we're going through that menopause series right now, so check out the other.
That concludes today's episode of Beyond the Superficial. Thank you for joining us, and stay tuned for more episodes. For more information, please visit our website, www.officialsynapse.com, your partners in healthy living for optimal life. We would love to hear from you on how our podcast might be impacting your life. We also want to hear what interests you. Please leave your feedback on our media page at www.officialsynapse.com. Thanks again for listening, and we'll catch you in the next episode.